Once in a while, a medication comes along and grabs the public's attention as a game changer. Ozempic, brand name for Semaglutide, is considered just that by so many. By both prescribers and patients, but why? It's an injectable prescription medication that can lead to rapid weight loss. Ozempic is indicated, meaning FDA approved, for use in those with type 2 diabetes. One way it works is by being able to stimulate the release of insulin from the pancreas. Also, can slow down the emptying of food from the stomach and can have you feeling full for longer. Thus, you can see that Ozempic works by several ways. If you're asking, wouldn't nausea be a possible side effect? You're right to think so. Nausea is the most common side effect reported. Some other side effects include diarrhea, constipation, vomiting, and abdominal pain. You may have heard that it can help improve both blood sugar and A1C levels. Think of A1C as a measurement of how your blood sugar levels have been within the past 3 months. What you may not have heard is the additional benefit Ozempic provides. That benefit is by lowering the risk of major cardiovascular events in type 2 diabetics with heart disease. Major cardiovascular events like stroke, heart attack, and death. If you have type 1 diabetes, Ozempic is not FDA approved for you. As an injection, it is given subcutaneously, meaning just under the skin. The sites of administration include the upper arm, abdomen, and thigh. How often or frequently is it given? Once a week and on the same day each week. If you take insulin, do not mix it with Ozempic in the same syringe. Inspect the medication before use to ensure it's clear, colorless, and free of particles. If either of these inspection points are not met, do not use. Ozempic comes as a multi-dose, pre-filled pen in 3 different available strengths. It's important to note that there may be little to no glycemic effect in the first month of starting Ozempic. Treatment is started at 0.25 milligrams once a week for the first 4 weeks. Your doctor can then titrate the dose upward. A max of 2 milligrams per dose may be reached. However, your doctor will consider different factors when it comes to how high of a dose you're prescribed. The use of Ozempic for blood sugar control is indicated alongside diet and exercise. Think of the medication as a piece of the puzzle to a healthier you. As with many popular medications, Ozempic does have circulating myths. Here are 3 that you may have heard of. Myth number 1. Everyone experiences nausea. This is false, as not everyone will. Myth number 2. Once you start, you will have to be on Ozempic forever. This too is false. How long you may be on Ozempic will be based on multiple factors. Each person is different. Myth number 3. Ozempic face is expected. False once again. This can occur, but not everyone will experience it. The popular term Ozempic face refers to a sagging, wrinkly, hollow, or older-looking appearance. If the pen is unused, it's to be refrigerated. After first use, it can be refrigerated or stored at room temperature for up to 56 days. Do not use Ozempic if it freezes, and protect it from excessive heat and sunlight. Plan on becoming pregnant or are pregnant? Let your doctor know. Earlier we considered some common side effects. Let's now consider some warnings, precautions, or severe adverse reactions. Included are the risk of thyroid tumor or cancer, pancreatitis, and diabetic retinopathy complications. Hypoglycemia, acute kidney injury, gallbladder disease, and hypersensitivity are possible too. You should not use Ozempic if you or a family member ever had medullary thyroid carcinoma, you have multiple endocrine neoplasia syndrome type 2, or are allergic to semaglutide or one of its components. I hope you found this information helpful. As always, do your due diligence and speak with your healthcare provider. This content is not all-inclusive and may contain info that was later updated. An official resource is Ozempic.com. Please like and subscribe. I will see you guys in the next video.